So I think the main reason I wanted to do the eyes today is because I know so many people who've come to me who've had an Neogen course up in London before and have gone to multiple places because they've been left with no lashes or no eyebrows. And I think it's important that we, especially when we have women, we've got lash extensions or they've had the brows put into crazy concoctions. We don't want to frazzle it off, so we've got to be mindful. So at the beginning, when I first started, I did use this. I think it lasted all of about 40 minutes before I had a paddy with it and threw it. And so as rogue and as unglamorous as it may be, I protect it with a gauze. Oh, is that gone off? Oh no, we're back in the room. So let's turn this round. You'll be pleased to know I've took my heels off. No one is going to get damaged or burnt. Yeah, there we go. I'll turn that round. What if we got it on one? I might have to stand up high to get to. So obviously when we even when we think about treating the tear trough with dermal filler, sometimes if a patient isn't suitable for dermal filler, we'll look at the ways we can indirectly treat the tear trough. So I think it's the same when we're treating the eye as a whole, because this is why I don't just treat the eye, because in order to get a good result with an eye, I'm treating the forehead, I'm treating the temple region. So therefore we're treating the middle and upper third, and we're just leaving the lower third, which just feels abstract and unjustified. So that's the only reason. Unless somebody literally was like, that's all I want, then this is the protocol that I would do. So if you try and pop your chin up, Els, just simply because I can't reach you. So I'm going to start with around her forehead. So I always, similar to Chris, always start this way when I'm doing a full face, work my way around the orbital rim, go into the forehead. When I'm doing the forehead, I do the kind of cross pattern. I think Professor Sack, said to cross over in one of his papers because it's better coverage. I don't try and attempt that on the eye, especially when someone's as young and perfect and annoying as Ellie. But obviously when I do the forehead and the lateral portion, I will follow that protocol. So I'm just going to cover her brows and make sure I'm not singeing anything off. You ready, Els? By the way, she's never had a Neogen before, and this is necessary because she burns her patients daily, so she needs to understand. And she was similar to what Chris and Emily were saying earlier on. She started very conservative, and now she's really mean. So perhaps today we'll have a different impact on her. How are you feeling? How is it?
Yeah, it feels all right, actually.
Remember, you're not allowed to wince. You have to say how easy it is. So I think logistically, when I do this treatment, I always prepare, especially my female patients, for the smell of their hairs burning. Because if you don't, that's a really funny moment when they realise what that smell is and they're having a meltdown.
Kate, the other thing that they said in that paper was the nitric oxide. I appreciate I keep going on about this, but it's interesting. Is one of the effects of it is actually that it increases the number of follicles per unit. So it increases hair growth. So even if you singe it off, that's what I tell my patients. Just say, grow back better. But they use it for alopecia in certain parts of the world. What?
And that's fine.
That's fair.
Yeah, I don't know if that would be a selling factor, but...
They're definitely using it for alopecia in the Middle East.
Yes, that's a good point. So I think
Yes.
one of the things that I think we found that was so exciting by the study that we did was really the brow position. And I do think a lot of it is to do with, I know we can't say it has a lifting capacity, but I think obviously when you're working on that architecture of the skin across the forehead in the temporal region, it's going to have that impact. So she's had a crisscross around her forehead, and now we're going to go and do her eyes. So what I'll do is I tend to use the gauze just to press on her lashes and pull her lashes down. I've tried to do this with someone with the longest eyelash extensions, and literally as I'm touching them, you can see them having a meltdown in case I'm damaging them in any way. I'm like, do not worry, this is just silky soft gauze. No lashes will be hurt in this process. So I'm gonna go here. Well done, Els. Being so brave.
That's a really good point, actually. Putting the gauze on as a soft placer rather than the hard plastic.
We do get a lot of patients from Essex, so the lashes tend to come with the territory. Nothing wrong with a long lash. No, get that disclosure right in. But they are really tricky to navigate when they're really long.
Yeah.
And the same applies on the bottom. I literally put the gauze underneath the lashes and then flip it and pull the skin down.
That's good.
It's just, and also I think they don't necessarily see it, so they tend to not jump and startle.
It looks like you got more control than I did with the thing, which is really good.
The truth was, like, literally within the first 2 weeks of us doing the Neogen, Ellie did a patient, and it actually wasn't the case, because this patient, we'd look back on the before pictures and literally had no eyebrows at the beginning. Yeah. But literally was kicking off because she was like, I've got no eyebrows left, And Ellie's like, it's me, I'm rubbish. I was like, 1 minute, let me get the pictures up. She had none in the beginning, panic over. But after that, I was like, right, okay, we really need to refine this. No issues, please. So again, just putting that down. I'm going to go in again. But I always find as well, when you're covering it, I don't know if it's because they can't see as well, but they just don't seem to flinch.
I think there's also an element of pressure.
Yeah.
So when you put physical pressure on the skin, it will distract, And a gate theory works really effectively.
And then put them to sleep with my dulcet Mancunian tool. We
use, for a lot of procedures in my clinic, we use the little vibrating little tool thing. Genuinely, it looks like a sack of shit, but it's very, very effective in any procedure.
Okay, how many passes are you doing?
So one pass, I've just done the line and then the other line. So one pass here, I did a crisscross.
And how many lines then on the eyelid did you do?
2. Okay. So 2 here and 2 here. That's it. She's perfectly formed. But it does get tricky, obviously, when you've got someone who has got that excess skin. So there has been a time when I've grabbed Ellie into the room with me to hold down one side where I've pulled up at the top, because I have got huge man hands, but there are limitations to these beasts. So I have to be cautious. Luckily, I have that perk and I can get one of the girls to help me, but I don't feel bad about that, because if we want to really get that extension and get that full coverage, we've got to get in there somehow. And also, I think it's quite embarrassing. Excuse me, love, your skin's that laxed. You're a 2-man job. So I do it a lot more polite than that. Just turn your head for me, sweet. I'm just going to do the side. So again, obviously, we've done the forehead, upper and lower, and I'm just going to do richly around the side now, around the temple, going down towards orbital rim, because I just think if you're going to do it, all those areas just help get that lift. This light is probably making me look hideous, so I'm really not glad about that, so please don't judge me.
You're glowing, my love.
Don't lie, Raj, don't lie. Ellie's glowing. You haven't flinched once, love. I'm so impressed.
It does actually just feel like hot oil.
Yeah. It's all in the skill, you see. The skill of the doer. Right. I'm just going to do one here, and then I'm finished, I promise.
When you look at other devices for around the eyes,
What? What is there?
They aren't any as good as this because you can get so close to the lash lines.
If you're going to treat the eye, you've got to treat the eye. You've got to get in there. And what I know we've got certain machines who've now launched a new attachment